Ladies and gentlemen, my name is Subrata Sarkar. I'm a mechanical engineer working in manufacturing industry since last 22 years. Today's topic is weight loss surgery. Actually, it is not my area of specialization or expertise, or not related with my profession. But many of you have requested for this topic. That's why this video is made. Let's get into this subject. If someone has said my weight is 70 kg, it doesn't make any sense. The correctness of weight is a function of height of the person. For example, you can see in this chart. This chart is basically a BMI chart. The vertical axis represents this height, and the horizontal axis is the weight, and their area is plotted. So accordingly, if your height and weight is plotted, so the cross point comes in which area, that will be your category actually. So here you can see in this picture, if your weight is assumed 70 kg and if your height is 5 feet 11 inch, then this dot is coming in the green area, which is the healthy area. But for the person who has got the height of 5 feet 3 inch, then that point will come on the yellow area, which is basically the overweight area. And for the same weight 70 kg, if the height of the person is 4 feet 11 inch say, then this point will come on this brown area, which is basically obese area. So this is technically called this body mass index or BMI. The formula is your weight in kg divided by your height in meter square. For example, your height is, say your weight is 75 kg and your height is 5 feet 3 inch, means 63 inch, that is 1.6 meter, then your body mass index will be 75 divided by 1.6 into 1.6, that is 29.3. As per the this body mass index, there are a category of your health category. If your body mass index is less than 18.5, then you will be considered as underweight. If your body mass is between 18.5 to 24.9, then it will be considered as a normal body weight. And if it is 25 to 29.9, then it's overweight. If it is 29.9 to 34.9, then it will be considered as obese. If it is 35 to 39.9, then it is severely obese. If it is more than 40, it is morbid obese. If it is more than 60, then it will be called highly morbid. You can see this picture, this person has got body mass index less than 18, so they will be considered as underweight, and their body mass index is 18.5 to 24.9, that is a normal weight. And in this picture you can see this body mass index is 25 to 29.9, so they are overweight, and they have got next level, that is 30 to 34.9 body mass index, so they will be considered as obese. Their body mass index is 35 to 39.9, so that is severely obese, and their body mass index is more than 60, more than 40 and less than 60, so they are morbid obese. And if body mass index is more than 60, then they will be considered as the highly morbid. The basic reasons for obesity are, number one is the metabolic disorder, and is the hormonal imbalance. One is the laziness, and is the hereditary factor. In some cases it is post-surgery effect, some cases it is a medicinal effect, some cases it is emotional imbalance or environmental causes, or in most of the cases it is also this food addiction, actually eating addiction, you can say. Here in this picture you can see this is one of the major reasons actually for obesity. And obesity has got, when somebody is overweight, there are a lot of other diseases actually get into. Like for being overweight, there is a huge possibility of diabetes type 2, there's heart diseases, high blood pressure, cholesterol, gallbladder diseases, fatty liver diseases, osteoporosis, and sleep apnea, and even due to the overweight or obesity, it can cause results cancers. Especially for the women, there is a huge possibility of ovarian cancer for this obesity actually. You can see in this statistics, it's UK statistics, there is a say that 31% of the breast cancer are caused for the overweight. and 60% of the kidney cancer are for the overweight. It's said that in US, every year, on average, 4 lakhs people are died due to the obesity. So it is a very serious matter of concern. Now, if your body mass index is say up to 30 or maximum up to 35, then it's possible to control by dieting or doing physical exercise. As per doctor's suggestions, if your body mass index goes beyond 35, then there is a very rare possibility that you will get back to your normal weight by dieting or physical exercise. You have to go for a surgery, weight loss surgery like that, and which is called this bariatric surgery, this weight loss surgery. This is basically reducing the size and capacity of your stomach. This is a part of the stomach will be removed basically. And there are other different types of actually bariatric surgery. One is called this gastric bypass, which is basically resecting or rerouting your small intestine to a small gastric pouch. The bariatric surgery is not a new one, and it is not developed overnight or maybe in last 2 or 3 years. Actually, there are different step by step. Actually, this weight loss surgery came into the status of today. Like at the very beginning, like 1950, it was started with intestinal bypass actually, and 1966 open gastric bypass. Then 1978 gastric band came, and 1980 vertical banded gastroplasty came. And there are a lot of other different steps, very medical specific actually. And in 2000 laparoscopic gastric sleeve actually, which I'll explain a little more today. This gastric banding is basically, there are some banding which will band some portion of your making knot, like something locking of some portion of your stomach, so that your net volume of the stomach will be reduced. So your and this is one of the way actually for weight loss surgery. Consider it is also reversible. If the patient doesn't feel, so they can remove this band and they can get back their original stomach. But this is not very effective, as doctor said, and statistics said actually. This doesn't make a good results. Very few percentage get these effective weight losses. And the next one is this sleeve gastrectomy. This is basically a removal of a major part of your stomach will be removed by special, this is the latest modern surgical process. It can be removed 50%, maybe 70%, maybe 80%, depending on the obesity of the person, that is BMI of the person. But one of the negative side is that it is irreversible. You cannot get back your original stomach anymore. But maybe if your food intake is getting, you can increase day by day, but then there is a chance that by your stomach will be a little bit enlarged after maybe after 5 years or 10 years. Now, the person who has got the body mass index 35 to 40, they are suggested to do this, this gastric sleeve, that is the removal of the stomach, partly removal of the stomach. And that will functions actually and very effectively and perform very better way. But the person whose BMI is much more actually, more than 40, then this part removal of the stomach doesn't work very well actually. For them, this gastric bypass is suggested. And I also got the opportunity to see this, this gastric sleeve operations in a very modern hospital in Kolkata. So I know I have seen all these these equipments and the process and the techniques. It's a latest modern technology, and it is I can say it's safe also. And there are process. This basically it is a laparoscopic process, and there is a special stapling tools by which the stomach, this cutting and stitching of the stomach at the same time. And you can see this picture this way, from one port of your this surgery, this stomach gets removed. But bariatric surgery is not so popular in India at this moment. It is basically mostly popular in US, Canada, Mexico, and European countries. But day by day, people are doing bariatric surgeries in India. It's getting popular actually. You can see this picture of the Indian woman. She's got 120 kg before surgery, and after surgery, after 1 year, got 75 kgs actually. So it work 100% actually. This this bariatric surgery for weight loss reduction, and it's not limited to the female actually. This male are also doing this, and not limited to the the aged people. These young male females are also doing this, depending on in different countries. People are doing this, different age groups. But after operations, the patient need to understand that now your stomach size is not as before; it is much smaller in size. So there are a lot of food will be restricted, and there are this food intake quantity will be very much restricted actually, as stomach size is less. But frequency of the taking food should be increased actually. So like cold drinks, these green vegetables and many other fruits and many items are restricted after these operations, and conceptually this most of the food after this bariatric operation has to be this protein content, like the fish, like some of the milk products, and beef, mutton, pork, like that. And there are also other these additional advantages after doing this bariatric surgery, like if you have sleep apnea, asthma, diabetes, or depression, heart diseases. These are the diseases actually the person who do this bariatric operation will be rid of after maybe 70%, 80% maybe after 1 year. So there are also a lot of additional diseases which will be cured after doing this bariatric operations. But there are also possible complications for bariatric surgery. Like there could be some immediate complication of the bariatric surgery, like after operation, there could be the infection or bleeding, there could be blockage in the intestine, there could be dehydration problems, there could be blood clot in the leg of the patients, there could be vitamin deficiency or protein malfunctioning, and there could be other long-term complications. That is, after 3 months, 4 months doing these operations, some problems may come up for the bariatric operations. These are like dumping syndrome, like maybe anemia, maybe dehydration, maybe depression, so maybe this incisional hernia, maybe a staple line failure. So there are always risk factor in every surgery. So this is also like similar for bariatric surgery. And statistics said that in 2003, the total number of the bariatric patients in the world was 1,20,000, and in 2013 it's 5.3 lakhs. And by now, 2017, it touches close to 10 lakhs. So that is 1 million in the worldwide. And let us have understanding of the mortality rate of the bariatric surgery. Bariatric surgery is not so risky like open bypass of heart surgery, like that. Many of you have some idea of the hip replacement, because I have to compare with this surgery with some other known surgery. Then this hip replacement is not a very critical or dangerous or very risk-taking surgery. The percentage of mortality of the bariatric surgery is 50% that of the hip replacement if we compare with any known surgery. We all know this health is wealth, but we need to make it in real life actually, not in the paper or in good words actually. Like so many people spend their health for gaining wealth. Actually, that is, they don't take care of the health. So they are running behind for earning money, but at the end actually what happens, they need to spend a lot of money to gain back their health, but they don't get it actually in real sense. It's not possible. Actually, that is said that never trade with your health for getting wealth, because you will not get back the same actually. So it is suggested for all of us actually, they eat better, run more, sleep earlier, which is very much concerned today actually. People are doing internet a lot of things for midnight, so this is not suggested actually. We should have a very good breakfast, drink a lot of water drinking, eat a lot of good foods, listen more actually, talk less. That's very important actually, and experience life and be happy. If you find this presentation is important for you or it is informative for you, you can subscribe this. You can give your comments. Thank you very much for watching.